As Methodist Healthcare Ministry celebrated its 25-year history, it recognized opportunities to deepen the impact of the work it's been doing across South Texas by sharpening its focus on health equity. Methodist Healthcare Ministry seeks to improve the health and well-being of both the people and places it serves. Health equity is the lens through which Methodist Healthcare Ministry seeks to reduce systemic barriers to health by supporting resilient individuals and families. This video series focuses on each of Methodist Healthcare Ministry's 7 regions, sharing community voices whose stories shed light on the history of inequity in those regions, and the people and partners who are making strides to change it by going on a journey from charity toward equity and building self-sustaining, thriving communities.
I would describe the community as a up-and-coming, thriving community with a lot of progressive leadership. That's kind of the unique thing about San Angelo.
We're off the beaten path. We have some things that they have in cities, but we're a small community. It's a family community.
If you look at compared to other cities in the West Texas area, San Angelo seems to be drawing a lot of diverse type of people in the community.
I love that if you want to become involved in the community, it's open. Everybody wants you to be a part of the solution. It's easy to get involved in an issue that you feel strongly and passionate about. And I think that makes it unique, and I think that is why, when we, with our limited resources, we pull those together and we work as a team. We work as partners, and we really tackle issues as a community, and that's what I really love about San Angelo.
And there's a lot of nonprofit agencies that really have a great impact. One entity that has really grown, that has a big impact on this city, is West Texas Counseling and Guidance.
There's a lot of services out there that are available that people either believe that they don't exist or they can't access them. And there are true boundaries. Transportation was one of the barriers to them receiving those services. And then the other one was the perceived cost. People don't realize that, hey, there's places out there where you can go, and if you don't have any money or insurance, no problem. You get the same services that somebody that is paying full fee, but there's a perceived boundary that, hey, I can't afford this. I can't get there.
Come to find out that a lot of times those services are available, but people won't take advantage of them because they don't want people to look at them as a person that has a mental health issue.
The worst thing for depression and anxiety, it is isolation. And so here you have people that are disconnected, they're isolated, and people that may have not been depressed in the past, now they're struggling with depression as well.
However, a lot of these people, they don't have a ride. They don't have the means to go to down to the hospital to get their records, or go to Vital Records and order those things. Why? Because they don't have an ID to get them. And so it's harder for them to get those things that they need.
We do have local public transportation. The hard part is, and just use an example, if you have someone that needs to take a kiddo to daycare and then to go to work, if the bus is their only transportation, it takes 2 hours to get anywhere.
So if you go in to a place and you only need to be in there 5 or 10 minutes, now you've got to wait another 50 minutes so that you can get back on the transit to get to the next place wherever you need to go. And because of that holdup, you might not even be able to get there on time.
As far as outreach, we try to be as central as possible. We do go into the rural communities of Ozona, Sonora, Brady, Mason, Menard, Junction. And so we do send therapists out into those locations. And then now we've done we've made a real push for telehealth.
For a lot of places, internet is a big deal, but one of the things that we've done is we've partnered. If you'll notice, you'll hear me say that a lot. We've partnered with different people to make access available with the Wi-Fi, the MiFis, and we even have some that will we have programs where if they're doing training, they might have computers available to them. And if they need a MiFi, we can help provide that based on some of our partners. So it really is a community effort.
Economically, one of the problems with San Angelo is that we don't have a industrial base to draw income from, revenue from. And that kind of hinders a lot of our programs. Keeps us from doing things in the community that we want to do.
Because the big businesses are gone. I believe I heard that Levi Strauss used to be here. San Angelo used to be, I don't think it is anymore, the sheep capital of the world, but they're gone. So how do you rebound? By building up the smaller mom and pop businesses and getting people to support those.
We have a problem with affordable housing, or a lack of affordable housing. I think there's a study conducted several years back, and one of the first things they identified was the shortfall, the housing stock of affordable housing. I think there's a need for about anywhere from 4,000 to 5,000 more units to accommodate the growing population. One of the first programs we started with was to go in there and kind of revitalize that specific neighborhood on the west side of Blackshear, because the boundaries were there. We had a major highway, we had railroad, it was a nice consolidated area that we could focus on, and we did. And if you look at it now, we went from 73% substandard housing to about 23% of substandard housing. And we've completely turned it around. And we did it with all the stakeholders, nonprofits. We did it with city funding, city infrastructure development, those kind of things, and it worked.
One of the things we've really been focusing on is helping people learn to dream again, because it's been a really rough year for a lot of people, and a lot of people like to say that we're in this together. No, some of us we're in the same storm, but we're not all in the same boat.
Working with the homeless community, there are a lot of people that are out there suffering with a lot of mental issues, or even physical issues, high blood pressure, diabetes, whatever, but they can't meet those needs because they don't have insurance. They don't have a way to get their medicine.
When the Salvation Army closed its shelter down, that created a barrier right there. You had Tent City that used to be up under the bridge when I first got here, and then they got dislocated because of the city ordinance that, okay, you cannot be here, you need to move. And so in order for them to get the help they needed, whether it's food or other resources, they were pushed even further away from transit. And yes, it's a little bit more of an effort to walk, but the aid that they needed to get here was not available to them because of their dislocation, if you will.
So we've come up with a solution. The solution is called Housing First. What we try to do is get them off the street first, get them into a house, because how do you solve homelessness? You get everybody a house. I know it's simplistic, but it's true. That's how you solve homelessness. Get them into housing. So we get them in there first, and then we try to provide case management over time at their speed.
When I talk about equity, sometimes we change, we utilize a lot of different words, and we try and we want things to be equal. No, I don't want them necessarily to be equal. If I'm 4 feet tall, you're 6 feet tall, and we're trying to see a 7-foot fence, 1 foot is not gonna help me at 4 feet. I'm gonna still be looking at the fence. Equity means we remove the fence so everybody can see.
Everybody needs a hand, maybe not a handout, but a hand up. You know, in the military, we have the saying, each one, reach one, teach one. So if I get to a certain level, it's my responsibility to go back and to reach one and grab them and pull them up, or show them how to do it, how to pull themselves up out of their bootstraps. But I don't believe in that, because we all need help. And I've seen it, especially with the people that come through here, everybody needs help. Even me as a pastor, doing what I do. I can't do what I do without help. I can't do what I need to do without some type of assistance.
What I love about, West Texas Counseling and Guidance, and we're only able to do this through MHM, is you can have somebody that is obviously, that is paying full fee for services, and then right, a couple of seats down, you got somebody with their backpack with everything that they own in that backpack, and they're receiving that same service, the same quality service. And to me, that's equity.
And I believe the city, we're headed there. The MHMR is having a bigger impact in this community. Los Esperanza is doing it. West Texas Counseling and Guidance is doing it. And so I believe as long as we continue to pull together and work together, that we'll have a bigger impact, so that the health disparity will not, hopefully one day it'll be gone. But that's what we strive for.
So that's happening. It's just one of my mentors, Craig Myers, said, it's just steady doing what we know need to be done. There will be people who would jump on the bandwagon and be gun-ho for a little bit, but we just keep being steady, because they will fall off. But we have to, this community, we have to just keep being steady.